Hello everyone, my name is Ryan Robertson with OrthoVirginia. I'm one of our hip and knee replacement surgeons. Today I'm going to be helping get you set up and ready for your hip video visit. First off, we need to make sure that you're set up for OrthoVirginia's MyChart. If you do not already have an account, don't worry, it's easy. We'll have you go to our website, www.orthovirginia.com, to sign up. On the website, we also have a great guide that gives you step-by-step instructions on how to set this up. If you have any trouble, by all means, reach out to us. We'll help in the process. Once you have MyChart set up, next thing we'll need you to do is download the MyChart application onto your smartphone or tablet. Next, we'll need to get you familiar with our Zoom software. We've chosen Zoom as our telecommunication platform for doing our video conferencing. Overall, it's been working out great for us. To do this on your smartphone, which is our preferred device, or on your tablet, go to the applications and download the Zoom app. If you're using a computer, we'll need you to download the Zoom software. Also, along with the computer, you need to make sure that you have a camera or a video conferencing access on your computer. Next step that is helpful in preparing for your visit is to make sure that you've given access to your microphone so we can adequately hear you, as well as giving access to your camera so that we can adequately see you. When you do call in to make your visit, you need to also give access for the audio through the internet. The next step that can be helpful in preparing for this visit is to practice. We have noticed that a couple patients, when they do sign on, either have trouble giving access to their microphone so we can't adequately hear them, or they have trouble giving access to their camera so we have trouble seeing them. So preparing ahead of time will make sure that we avoid this issue. Along with the preparing for those aspects ahead of time, it is helpful, as I do today, is having a helper who can manage the camera for you. This allows for us to adequately see you during our visit. If you do not have a helper, you need to be able to practice with your smartphone, setting it up, or using a computer camera to adequately be able to see you completely. Specifically for the hip, I need to be able to see you from your hip down to your leg. If you have a helper, this a lot of times can be done a lot easier. Specifically along with the hip, with the exam portion, I likely will have you flex up your hip during the exam, as well as externally rotate and internally rotate, as well as abduct and adduct. So being available and ready to do that. Sometimes it can be helpful to have a table or a bed that allows you to lay down so that we can adequately see you extend your hip, and then again, easily flex up your hip, externally rotate your hip, internally rotate your hip, abduct your hip, and adduct your hip. On top of motioning for the hip, it is helpful to see you actually just stand up to see your posture, as well as to see how your hip affects your posture, and then also seeing how your hip affects how you walk, and if you have any limp or other abnormalities from that. If we're able to do all of these things, we should have a very successful video visit. I appreciate and thank you for taking the time to prepare for this ahead of time, and I wish you all the best and good luck.